Hello everybody, welcome to Dr. Chan's Minor Ailments Forum today, and I would just want to spend about a minute talking about whether you can actually take over-the-counter pain control if you've got high blood pressure. And the reason that I chose this topic is because the weather is really good in the UK recently, and quite a lot of us been doing a lot more gardening and barbecue and so on and so forth. And we have a lot more patients coming in and saying that they've got back pain or muscle pain or been doing too much DIY and hurting the shoulder, etc. So they trying to save the GP times, which is really good of them, and they go to the pharmacist to kind of ask what kind of medication they can take. And the pharmacist turned around and said, oh, well, you're on quite a few blood pressure medication. Maybe it's worth you going to see your GP first and for them to decide what kind of pain control you can take. Now, I find this interesting, so I thought that I just want to have a quick chat with you. Over-the-counter pain control, including paracetamol, ibuprofen, or even diclofenac, something similar to that, potentially can put your blood pressure up, but the effect tends to be very minor. Now, although I said that the effect of getting your blood pressure higher than usual is minor, it can affect the people who normally don't have high blood pressure and can also affect the people who already have high blood pressure. So that the pharmacists have to be a little bit more careful when they're selling these medications to you because they don't actually know your medical history. So let's just talk about ibuprofen, or the group of medication under the umbrella non-steroidal anti-inflammatories. So these medications are medication to control pain but also reduce the inflammation. So let's just talk about ibuprofen because this is the most common one that you can buy over the counter. And study has shown that potentially this medication can cause water retention or affect the excretion of the sodium from your system. So if those two combined with, let's say you've got high blood pressure already, it might make your blood pressure go slightly higher. Now, although the effect might be minimal, but if your blood pressure is not very well controlled, let's say it's 200 over 100, then it might have a massive effect, even though ibuprofen can only push your blood pressure up a little bit. So this is one of the reasons why they tend to worry about selling this to people who are already on blood pressure medications. So another interesting fact is that some blood pressure medication, for example, ACE inhibitor, although on the long run protect your kidney function, but in the short term can affect your kidney function. Let's just say if you're taking the ACE inhibitor, but also taking water tablets and also taking anti-inflammatories for quite a period of time, it actually could have quite a lot of impact on the kidney. So we really have to watch out on medication in combinations. And another thing is not just non-steroidal anti-inflammatories that we have to worry about, but also medication like paracetamol, which is very harmless. You can buy it everywhere, and also cocodamol, which is a combination of codeine and paracetamol. If you take them for too long, it can also affect yourself as well in different ways. For example, number one, it can affect your kidney functions, and number two, it could potentially affect your liver function if you take it for too long, and especially if you're exceeding the dose. Now, some people don't know that cocodamol is actually a combination of codeine and paracetamol. So they think, oh, I've been taking cocodamol and the pain is still really bad, so I might as well add some paracetamol on top, which is a wrong thing to do because, as I said earlier on, cocodamol already contains paracetamol. So if you take paracetamol on top, you can risk causing an overdose. So you just have to be very careful with the over-counter medications. So I hope that the information is useful for you, and please don't hesitate to contact your GP or any other health professionals if you've got further queries. So for now, take care of yourself and we'll meet again soon. Bye bye.